So we've talked a lot about workforce, and I just wanted to take a step deeper on what that really means to the consumer. So the first place I wanted to highlight was our long-term care system. You know, we heard in the first panel about the growing, aging population in our state, and we also talked about rural being, older, sicker. We know that right now, on average, 38% of the households in Wisconsin have at least one person over the age of 65. That increases in rural communities. Our neighboring Adams County, 58% of the households have at least one person in them 65 years and older. And with the current workforce crisis, that is hitting our system in different aspects. It's not an equally our system isn't being hit equally by the workforce challenge. So we know the long-term care system has been hit harder. What that means to real people is that over 18,000 people in Wisconsin this year needed long-term care assistance and were denied or delayed that assistance. That's from a long-term care report that was released just this year. And so if you think about that from the family perspective, right, 58% of Adams County's families have someone 65 years and older, and they can't get the long-term care needs they have. That means families are taking care of their families. And so a personal story I can share is I have a friend who is about my age, is an executive at a bank in Dane County, and her mother-in-law had a stroke. She lived independently all by herself, doing great. She has a stroke. Now she's faced with, I have to quit my job to take care of my mother-in-law because I can't get her the support she needs, right? So we're just exacerbating those workforce needs because we as a community can't figure out how to support her mother-in-law. We're seeing similar things in behavioral health and substance use. We know 1 in 4 youth have mental health issues. We probably don't have to debate the substance use issues we had before the pandemic and now, right? And we are, we've talked a lot about nurses and physicians, but we also have mental health therapists and providers that we're lacking right now in our community, and those issues will continue to exacerbate. It's going to impact our schools. It's going to impact our prison system. It's going to impact a whole other slew of system issues, right? As we look at that from a consumer perspective of how do we, support and treat, really on the support side, kind of our community members, our Wisconsinites. The last thing I'll highlight, not to get provocative, but really Dana talked about the high quality of care we have in our system, and I think that is true in a lot of cases. But we also know if you are white, middle class, and have a college education, you have really a good chance of having strong health outcomes and getting really high quality care. That's just not true. That's not what it looks like for the rest of our population. And so we have the lowest, and this, as a mom, it about makes me quiver. We have the worst rate in our nation for infant deaths as it relates to Black babies. One in every 15 of every 1,000 Black babies die in Wisconsin, which is the worst in our nation. So when you think about crisis and what that looks like, and you think about solving workforce challenges and cost challenges and all of the other challenges we're faced with, right? And I don't mean to be, the bearer of bad news, right? But that hits our population differently. And so this isn't a situation where we can just throw money at it, or we can just, throw things into communities without really thinking about where we're putting those resources and how we're really matching that to address those biggest needs. Or it's going to perpetuate those gaps. It's going to add more cost to our system. And we're still going to have these challenges that are going to just get bigger and bigger for us. So I maybe a different take on that from a consumer perspective, but those would be the 3 things I would highlight as we look at kind of what are those crises ahead of us from a consumer perspective.